Hello, everybody. Welcome to our presentation today about our health professional education offerings at the University of Notre Dame. My name's Michael Wade. I'm a prospective student advisor at Notre Dame and will be emceeing this presentation. Joining me today is Dr. Lorna Davin and Dr. Kylie Russell, who are both academics currently working out of our School of Medicine, facilitating some of our postgraduate program offerings. In terms of what we're going to be covering today, we're going to be looking at why you might choose to study at Notre Dame, the health professional education, postgrad options at Notre Dame. We'll also be having a look at a newly proposed program, Health Leadership, which we're looking at commencing hopefully soon. We'll look at the entry requirements for the programs as well as the process of applying to them. So the things that it is that kind of make Notre Dame unique amongst all of the various tertiary institutions in Australia. There's kind of four key points. So the first is that we are a national university. So we have 3 campuses, which you'll be hearing about quite shortly. They're located from coast to coast. The postgraduate programs that we'll be talking about specifically, they are offered in either online format or in a potentially blended format. So you can study at Notre Dame from all over Australia, potentially with the need to travel a little bit, but potentially not too much depending on what program you pick. The second point, so all of our academics, they're all very well versed in their particular professions. They have a lot of experience which they can draw upon in terms of helping to guide your studies, so you can help so it can help you feel quite supported in your learning that you undertake with us. You can also leverage a lot of their experience because they are quite experienced. The third is that you have the option to progress on potentially into research as part of your postgrad study. So there are research options built into a lot of our coursework postgraduate degrees that let you undertake a little bit of research as part of them, even though they're primarily coursework. And you can use this potentially as a platform to go on and do further research-focused masters or even PhDs potentially. And then finally is that we do have a holistic approach to the teaching at Notre Dame. So you do really get to know your academics as part of your learning with us, and they really get to know you even through the online study. So again, they can support you and get to know you, and you can also again get to know them and again leverage their experience quite readily. As I mentioned, we are a national university, so we've got 3 physical campuses, one in Fremantle, one in Sydney, and one in Broome. I will talk mainly about the Fremantle campus because the 2 programs we'll be talking about a little bit later on are primarily facilitated through the Fremantle campus and academics located there. So the Fremantle campus, it is the oldest campus of Notre Dame, founded way back in 1989. It's located all throughout the historic west end of Fremantle, and should you study your programs with us, even though there is lots of online components, if you are in the Fremantle or the Perth metro area, you can always make use of the facilities on the Fremantle campus as part of your studies and learning. Now, another factor that might prompt you to study with Notre Dame is that the student experience at Notre Dame is quite good. We're rated quite highly through the federal government's Quality Indicators for Learning and Teaching survey. So this is a survey that the federal government does annually, where they find out how current students and graduate students have found their experience at the particular place that they have studied, and Notre Dame does quite well at this survey on a very, very regular basis. We're currently rated #1 in Australia for learner engagement, skills development, student support, and teaching quality at a postgraduate level. So all very, very good indicators. Now, more specifically, again, within the health sector as well. So one of the things that we were primarily established as was to help facilitate training for the various health professions. So we've always had a very strong strong focus on this area. This again reflects in the ratings that we have in that specific area in terms of postgrad medicine training. So we're rated #1 in WA for the overall quality of educational experience, #1 in WA for teaching quality and skills development, specifically for training around the health professions. So again, it's always been a strong focus for us. Now I'll introduce again our academics again. So we've got Lorna Davin. So Lorna is a senior lecturer in medicine at the School of Medicine at Notre Dame and has been the postgrad coordinator for the health professional education postgrad degrees for quite some time. She has 20 years of experience in the medical sector. So again, very well knowledgeable about all of the things that she teaches about. We also have Kylie Russell as well, who's an associate professor here at Notre Dame and has previously worked quite a bit through our School of Nursing and Midwifery as the postgrad coordinator and the clinical placement coordinator there as well, and is now looking to head up the postgraduate health leadership program through our School of Medicine, which you'll be hearing about shortly. So we'll now move on to speak about the programs, starting with the health professional education. So I'll pass over to Lorna now, who can tell us all about it.
Thank you so much, Michael, and welcome everyone. It's great to have the opportunity to talk to you about our health professional education suite of postgraduate studies. I'm very passionate about the program. I see it as a way to engage with both clinicians and academics to use education as a vehicle to indirectly improve patient care. So everything we do in the program is centered around, at the end of the day, patient care. Something else that makes us really unique, I think, in this program is we're very focused, or have traditionally been in the past, in both medical, nursing and allied health, being very focused on knowledge and content. And what we look at is much broader in this program. We look at skills as well as attributes, but we don't just look at content, we look at the context in which you work. So we try and make the content of the course very relevant to your actual practice. So whether you're a clinical educator in medicine, nursing, allied health or midwifery, or whether you're an academic in a university, we try and make the course relevant to you and meaningful to you, also so it doesn't add too much to your workload. So one of the things that I've found with people, students or staff or clinicians that approach me is they're often intuitively, if they're interested in education, they're doing really good work and making an enormous contribution in the clinical environment, either as a nurse educator or as a midwife in the educational area, in the health professions, allied health professions, or as a doctor, a medical doctor. And that might be in community health, or it might be in a big tertiary teaching hospital, it might be in the city, or it might be in a remote area. But one of the things people usually say to me is, I'm doing all these things, but I don't have the theory that underpins it. So what this course or what this program gives is the theory that underpins why some of the things that you do work really well and why some might not, but also how do we determine that? So it's not so much a science, it's more of part of the arts and humanities, in that we look at building understanding rather than nailing the science of it. As Michael said, it's a nested study that you can do a graduate certificate, diploma or a master's level, and I'll talk about that in a moment, in that it's a nested degree, and I'll go through the different offerings we have. So depending on where you are in your training pathway or in your career, you might be older, you might be someone, say, that's done nursing before it was actually taught in the university sector, or you might be an intern that's just come in, just done their first year of internship as a medical doctor, or you might be working as a dentist or a physio and think, well, where's the best starting point for me? So it's very much tailored to your individual needs. You can come in and start with the graduate certificate, graduate and then come back to us and do the diploma and travel through to the masters, or you can enroll in the masters and do the courses. So we'll have a look at the courses now, Michael, if you just Oh, okay, before we move on to the courses, this is a slide which I actually really like because it captures the engagement of the students as the learners. One of the things I really encourage in our programs is that we don't talk about ourselves so much as teachers. We're all adult learners and we facilitate learning rather than that didactic notion of teaching and being the expert. It's much more sharing our wealth of expertise. So you as the learner and me as a learner, we talk about what we can do differently to improve our understanding. So in this actual slide, we have two of our actual colleagues here in the School of Medicine. They're both doctors. One in the blue skirt is a medical doctor and she works out in the rural area, and she is a graduate of our program. And the other is a medical scientist who has a PhD, and she works teaching our students. And this is a group of medical students, and you can see they're doing something around function. But an important part of our learning and the way in which we run this course is it shouldn't just be educational, but it should also be enjoyable. So that slide, I think, captures a lot about our whole approach. So thanks, Michael. We'll move on to the next slide now. Yeah, so looking at what you can actually do, the graduate certificate gives you the foundational underpinning theory. So you look at the theory, we look at contemporary issues, which is enormous at the moment and very relevant with the pandemic. We look at the reduced number of opportunities for clinical learning as patients are more quickly discharged from the hospitals. We look at global health, which is really relevant at the moment. We look at the notion of supervision, which is really unique in the clinical environment because the risks are enormous. And so what it means around mentoring and role modeling, all those aspects. And we look at teaching clinical reasoning, which clinical reasoning is something that really differentiates us across, I suppose, the more generalised graduate certificates in tertiary education, because teaching clinical reasoning, or the whole construct of clinical reasoning, is so important and crucial to what our clinicians do, and the risks are enormous if they get it wrong. So it's a complex construct that really sets us apart. So you can do, applying theory Medi 5121 is a compulsory course, or what you may know as a unit we call courses. So that's one that you have to do as a foundational course, but otherwise there's some flexibility for you. Then we have the graduate diploma. We look at ethical issues, which working in health is enormous, obviously. We look at assessing competence, which again, as I said, we use a lot of jargon in education and in health and in medicine. What do we mean by competence? What does it mean when we tick someone off saying they're competent? So we challenge a lot of the assumptions we make. And then you can do, depending if you're working in the academic environment or in the clinical environment, you can do courses like designing curriculum and look more closely at the principles and practice of assessment. Then, if you're keen, you can go on and do research methods, which is a foundational unit or course for your masters. So we look at both quantitative and qualitative. So how you can define and develop a research project, and then you do a dissertation, which being a coursework program is quite manageable, and it's quite pragmatic too, in that the expectation is that you do your research and then you capture it as a journal article that can be published in a journal that's relevant to your discipline. So it's a real opportunity to get a publication. So thanks, Michael. We'll move on to the final slide there. And so from an entry requirements point of view, you need a bachelor's degree or equivalent in a health professional field. But most importantly, you need to have active involvement in health professional education. So as I said, we develop our assessments according, so we have assessments, we don't have exams, so it's continual assessment across the program, and it's steeped in what you're doing in in your clinical or academic practice. And so it might be doing a video of your actual, where you're facilitating an educational session. It might be looking at how you evaluate what you do. So we need you to be involved in education at some level. So, and we're flexible because some people are transitioning from one role to another. So we do offer a lot of support. One of the key things, now everyone at the moment's been moving online. This course has always been 100% online. We offer it to students. We're going offshore as well, but within Australia and New Zealand, and we've got students in Queensland, we've got students in Victoria, South Australia, we've got students from all over the place, remote, rural, regional and urban. So in that sense, we've got a real strength. It's been something, our course was designed as an online course, and it gives you the freedom as a clinician, if you're working in a busy clinical environment, to engage when it works for you. So we've got our next intake coming up mid-year, so for the 27th of July. So we welcome anyone who would like to join us for the next semester. Please don't hesitate in getting in touch. So thank you, Michael.
Awesome. Thank you, Lorna. We'll now have Kylie let us know all about the new program that we're looking at running at Notre Dame on health leadership.
Thank you, Michael. Look, I'm like Lorna, I'm very passionate about leadership in health, and I'm very excited about this program. So this is a new program for the University of Notre Dame that we're hoping or aiming to have in place for next year. Essentially, this program is a little different to anything else that we offer on campus. So if you'll bear with me, I'll go through some of the complexities of it and try and make it easy for you to understand, because there are different pathways into the program, and the program doesn't follow a traditional academic on-campus or online program, but that's actually the beauty of this program, in that it's designed for industry, by industry, in collaboration with industry. So the new program will consist of a graduate certificate, a graduate diploma, and a master's in health leadership. So as Lorna explained with the health professional education, there's also that opportunity to tailor the level of learning that you feel you're ready to engage in at this time in your career. So the graduate certificate is in pure collaboration with the WA Government Department of Health, so who we refer to as WA Health. And then for the diploma year and the master's year, you then become what we call a traditional student, a part of our normal cohort of students on campus. I'll just explain a little bit more about what that means. So essentially in that first year of the graduate certificate, it is a partnership of Notre Dame School of Medicine with contribution from the School of Nursing and Midwifery with the Department of Health. Now, because we're working so closely together to deliver this program, it actually means there's a significant cost-saving benefit as well for our students. Because for us as a university, we're not providing all of the teaching. It's actually being provided by industry experts. That actually reduces the costs, which we transfer to the student. So unlike a traditional program at a graduate certificate level that can cost between $8,000 and $10,000 at universities around Australia, it's actually going to be for $2,000. So what that means is students can enrol in the graduate certificate, they can partake in that learning, and they can graduate within that space with the graduate certificate. After that stage, if you would like to continue with your learning into the diploma or the master's year, you then become a traditional Notre Dame student with the normal sort of course structure and course fees. We still engage with industry, but not to that same extent, because we're starting to go at a deeper level, and also, like the HPE, go more into the research focused as well, focused areas. So in the graduate certificate, students do need to complete it within a year. It is a fixed program, so you can't choose how many courses you'd like to do. It is fixed, and it's 2 courses. So the courses that we typically have are 25 credits, and you would normally do 4 courses for a graduate certificate. This is 2 courses of 50 credit points each, so they're a little bit larger, but they're taught across the year. So as a student, you're engaged in the learning across the year for both courses. You engage in your assessments across the year, and then you graduate at the end of the year. Now, those 2 courses, one is leadership and health, and the other is systems focused thinking. And the learning for this involves an on-campus and an online component. So you do need to be able to physically be at the Fremantle campus 4 times across the year. So if you don't live in the Perth metropolitan area, you still can enrol in the program, but we do require you to come to Fremantle on those 4 occasions. And for those of you who are employed in organisations like WA Health, they actually do like to support staff in some of those costs associated with coming down to the campus. So the way those on-campus days will work is we'll have all the students together, so it's a wonderful opportunity to network with colleagues that you know and new colleagues from across the health professions, from across WA Health, from our private sector and our NGO organisations as well. And during each of those days, we're having experts from industry to come along and talk to you about the course content, to share their knowledge and wealth of experience with you. What is actually contemporary, what is important in real leadership, what's actually happening out there in industry, particularly at the moment when we think of what's happening out there in health. Leadership is just so vital. So during those days, you'll have an opportunity to engage with those experts. They'll be there for you to talk to mingle with. But at the end of each of those days as well, we also have an opportunity for you to engage in topics of interest. We're going to have hot topics where you break into groups and you discuss the issues that are really important and start to actually think about some of the solutions and how you could take those into your workplace. In line with that, all of your assessments are work-based focused. So it's actually looking at your own work areas, identifying leadership types, essential leadership patterns of behaviour that can work in your particular environment, looking at projects or things that maybe need to change, how you can invest in change management, change champions, how you use your leadership skills to make those changes. So that's across that first year. And certainly we will be putting some information out on the website shortly about how you go about enrolling in that program. But essentially there will be 2 pathways. There'll be the traditional pathway, but there will also be an opportunity for nurses and midwives in WA to receive a further scholarship from the Nursing and Midwifery Office. So there's a joint enrolment process for those particular students who are interested. If you go on to the graduate diploma and masters, we have a suite of courses that will be available to you, and essentially you choose what you would like to do to further develop your leadership knowledge, skills and attributes. And those courses will actually be delivered across the university. So there'll be courses delivered by the School of Nursing and Midwifery, the School of Business and the School of Medicine. So you can actually tailor for yourself what is important for you and where you would like to be in the future. And then in your research year, like the HPE, you undertake a small research project to again focus on leadership, but with that research element to support you in your leadership aspirations. I think that's all for that slide. Thanks, Michael. So I'll hand over to you about the general pathway for enrolment.
Yes, so almost at the end of the presentation now, so just going over the application process. So the application process at Notre Dame for postgrad, outside of the possible kind of alternative pathway for nurses and midwives that Kylie mentioned. For the rest of the programs, you'd be looking at the traditional process, which involves submitting a direct application to Notre Dame. So you're able to do that online. So as postgrad programs, you would include information in terms of like transcript from previous studies, resume as well to show your professional experience. You can also include supporting documentations around other things like training that you might have done that maybe doesn't necessarily fit into, say, specific kind of traditional models of, tertiary education or TAFE study and things like that. We do have a holistic application process at Notre Dame, so we do look at those supporting documentations and things like that as well as part of the application process. So once you've submitted that online application, our admissions office will assess the application itself. They'll do so as fast as they can. The hope at the moment is that applicants that have been successful should hear from our admissions office within 2 to 4 weeks of submitting their application online. Generally, we'll hear first via email. So if you do submit an application, do check your inbox regularly, and also check junk mail as well. Sometimes offers get sent there. So just to make sure that you don't miss out on any offers, do check your junk box as well. With that said, that's been the presentation. So if you do have any other follow-up questions or queries after the session, can always email on campus directly by phone for a prospective student advisor to answer any questions, and also our general studies online email.